Okay, after the after I have done my clubbings, first I'm going to introduce the instruments. Here you can see there is a suture material pad, suturing pad. Okay, it is latex in build. So you can see this is so much softy, and you can hear there are different parts of skin layers. It is seems like different part of skin layer. That is it is a epidermal layer, this is subcutaneous tissue, and this is the dermis and the muscular layer also. So this is a full thickness of skin, and there are different kind of cutting areas like straight, ellipticals, like curved, like straight line. You can see straight line usually done in the musculosa or the lineal incision. VY plus T, there are VY incision, VY incision. Different kind of hole that is maybe laparoscopic probe, like 5 millimeters. It could be extended to 10 millimeters, 10 to 12 millimeters, and it is straight, elliptical, so V, and like these kind of things. This kind of pattern is usually done in a flap operation, like flap, when there is a gap. So we made an incision of above V and then turn out and keep close to each others and then bound it out. So there are different kind of suturing. So this is a good suturing pad that I ordered from the AliExpress and others. And you can see there are some instruments, like here it is called the needle holder. Okay, you can see the needle holders here, and the you can see here the needle holders. This is normal scissors, carved scissors. It will not use now. And this is the tooth forceps. Here you can see there is a tooth in tip of my forceps. It will help you to hold the skins. Okay, help you to hold skins. So that will be very important nowadays. Okay, here you can see some different kind of suture materials. As is a training gown, we'll use silk. Okay, silk is braided and non-absorbable suture materials. So it is ingredient is a natural elements. Okay, there are 4030. So different kind of suture material that will come with the package. So now I'm going to start with the 30 round body. There are different round bodies, cutting bodies. Okay, so I'll take the 30 round bodies. Okay, as you can see, it is very sterile, so nurses or the healthcare providers will open the unsterile part, and this is very unsterile. Okay, so it's very much coated for training purpose only. You can see this is a long suture materials. I can see this is so good. Okay, so now I'm going to, so as you see that this is all about the instrumentations. From the next part I'm going to show you some simple suturings, surgeon's knots and others. Okay, now I'm going to show you these simple sutures. Like here you can see this is the elliptical incisions. Here you can see that is the elliptical incision. So I'm going to cut a sutures here. Okay, 1 to 2 bites as examples of simple suturings. First you must hold these suture materials with your needle holders. Sorry. So you will hold the needle holders with the like anterior 2/3 and posterior 1/3. So in junctions I'm going to make just suturing. Here you can see this is silk. Okay, so first these two edges, it is incised on, okay, or surgical on. It will heal primarily. So first I'm going to start, okay, first fix the one edge, and about 90 degrees I'm going to put it on, and the serasa. Now hold the part, or this kind of arrangement is present here. So okay, so I'm going to pull it out. Okay, just stop. Now these edges and these edges, okay, so there are now I'm going to part another part of suturing style, that is here, same like the same in each moments. Like here you can see this is the area, here the areas, the same areas will be collected. Now the same distance, yes, the same distance I'm going to take. Now okay, you can put it on with the tooth forceps or with the needle holder also. You can see now I'm going to make a surgeon's knot or the square knots. Square knot means here the one end, now the 2 times you will grab it out, and then just here see one knotting, then the then the single knots is done. Okay, and the reverse knot will be done. Oh, this is the surgeon's knot or the simple suturing style. You can see each edges are become so much adhered with each other. Okay, so I'm going to cut the portion with few left out. Okay, so again I'm going to repeat the suturing for the practice only. First start with one end, then first introduce with one end, another end, I'll put it on here, okay. Now this part 2 times we will grab it on and see here, this is double knot is done, and square, that means 4 suturing, 2 is done here, 1 is for here, another is reverse knot. Okay, done. Now I'm going to cut it through here, few is left opened. As you can see here, the 2 edges are so much nearer with each other, so it is very adhered. Good suturing. This is the simple suturing techniques. I hope you understand that. Okay, now I'm going to make another one, that is vertical mattress. So I'm going to make a vertical mattress, that is 4 point incision. It is also called the 4 point incision or the vertical mattress. Now the vertical mattress like this. How? First I'm going to start these. I will pull on with the needle holder and the tooth forceps, and now another part, the same directions, like this. Here. Now by the same way, vertically I will going to reverse it, like here, same. From the point of view, transversely like this, and the same directions in the same way here, same directions. Oh, sorry, the shoe must be okay. As you can see, there is a less amount of scarring here. So the suturing is the braided silk, it was somehow sharp. In that case, there will be a problems attaching. Okay. So again, I'm going to make the same suturing here, here, and now here. You can see this, there is a no scar. There will be good adhesion, good appositions with each other. Now this part will be cut out. So again, I'm going to make this vertical incision again for a good practice. First hold this. Now here from the same direction, from the same point of view, here, this same. Here. Now, by the same way, it will be repeated like this, like the here, cut like this, and from the same point of view here, there will be another one that will be like this. So by this way, now I'm going to make, there is a problem here, with the suture material, because this is so sharp. Here, good appositions. Now I'm going to make the training here, like the same way from the first time. Okay, and the again done by this way. Here there is a good appositions here, there is a very good appositions here. So by this way you can make the vertical mattress. So now for that way I'm going to cut the rest of the part. Okay, so as you see here, the good apposition technique is the vertical mattress. Here you can see a good appositions here and here, but you can see there is scar and suture material is visible, but here there is no suture material visible in the incision line. That is the importance of this kind of suture material here. Okay, now the third suturing style was the horizontal mattress. You can see the vertical mattress, and now I will show you the horizontal mattress. Horizontal mattress is nothing but it is also 4-point, but there will be less scar, less suture material present in the incision site. How? Let's see. First I'm going to make this here the vertical incisions, so horizontal incisions. So I will take adequate space and adequate thickness, and the here you can see here this gently I'm going to pull because it is friable. And now here in the same way I reposition the, now here you can see the same thickness, same distance. I'll take that. You can see the same thickness in both sides. Same thickness both sides. Now like the same way I'm going to make it repeat. For this time same direction from each and every space. Like I will go down this way, I will take full thickness, and the here I'll put down that, and now again I will take like this, and here in the same distance I will make another. Okay, gently I'm going to push it out because it is so friable. Okay, so now you can see this is goes from the here and goes here, then again I will come back to the main positions. Now I'm going to make that surgeon's knot again 2 times. Here, like here, when I will take it will come closer. See, now single turn here and the reverse turn again. Some surgeons will repeat same things, which is not necessary sometimes. Okay, 3 to 6 times some surgeons are trying to use, because sometimes it will be problematic. Okay, so here you can see the incision line is so close, so adhesive, so there will be no scar, there will be good appositions of incised stone. Okay, now I'm going to cut that again. It's on every sides. So this is the horizontal mattress. That was vertical mattress, simple suturing, and the horizontal mattress. Hello. Now the next part of the suturing is subcuticular suturing. So I'm going to make a subcuticular suturing here. After the, so I will make another one, that is 40 silk. It is so much shiny, and it is a cutting body, so its tip is cutting in triangular in nature and sharp. So I'm going to make the subcuticular suturing, and which is done in the gynecology ward or the infant incision, or the more cosmetic. It is more cosmetic. Okay, so I will make this incision continuous in nature. So I'll make the subcuticular incision here by the continuing nature. First, like this. First here from the tip with the I'm just introducing, grab with another part, gently taken care of, but it will be so sharper, that's why I'll gently push it on. I'll left out in some portion. Okay, that portion will be left out. Now subcuticular means I will suture these two margin subcuticularly. How? Like you can see, there are some margins. This is serous subcutaneous, so I will go as far as I possible. So here I didn't make any knot, so like this, here under the serosa, here I will make here, gently I'm going to pull it on. Okay, and again I'll make the same things from here. From here I will hold it on here like this. You can see, gently coming closer. I'll not pull it because it will be friable, because silk is so much sharp and braided. Again I will do it like the same manners. Here you can see that I will gently pull it on because it is so sharp. Okay, again I'm going to make another bite like the same way. I'll pull it gently. It is more subcutaneous and more cosmetic, so we'll be very, very careful about the skin bridge. You must not breach the serosa or the keratinous layer. It must be under the epidermis. Now again I'm going to same things again and again. Like same things, I'm just gently go round and round. Okay, now you can see there is no suture material present in the serous layer. The whole length is material free. There will be no suture material here, just under the serosa. The same things I will do from the subcutaneously. Okay, here the same things I'm going to pull it down very much gently, because as I said. Okay. Now again I'll make the same things here. No. Yes. You see, I'm just gently pulling it on. By the same way. I'm just trying to be quicker here. A little bit worried about that. Okay. And then lastly, okay, you can see started from another region and ended in another region. So I will try to pull it on. Here we can see this is already been adhered with each other. Okay, so now I'm going to reverse it down and in same here I'm going to make a knot here only for temporary, and then again I will make another tour here. I'll reverse here, just I will make a small part here left open, and then make adhesive tape here, by which suture less subcutaneous skin incision is been done. You can see it will wide open, and in normally it will make like this. Okay, so this is the process of subcutaneous suturing, subcuticular suturing. Now I'm going to start the continuous suturing. Continuous suturing is very important for mask closure, not only mask closure but also any wide open wound where the two edges of the wound is not opposed with each other and there is a very large gap inside. In that case we have to make a tension suturing, so that the continuous suturing is the best. Okay, so continuous suturing, so I will make a continuous suturing where here. So I'll make this is since it is a linea alba incision or the midline abdominal incisions, so I'm going to make a mask closure or the continuous suturing here. How? First you can see the same direction. I'll make incision here, okay. So first I will make stable suturing here first. This is surgeon's knot or this square knot. Square knot is done here, so it will be tighter. Next time again okay. I will cut one end. Okay, this end will be regarded as a continuous material. How? Let me show you. Okay, here I'm going to make a continuous, so again it will be regarded as a continuous. Again okay, again you can see. So again I make this incision again, same direction or the same way. These things is not function because so much friable here. Okay, no problem. I'll make another. very disgusting. Again this done. You can have interlocking here, or if you don't want that, okay, like this way. If you want to do interlocking, there will be different things. Okay, I'll make an interlocking here. So when I give here the last portion, then it will be a last part. So here you can see so this is a knot a loop. So I'm going to pass it on, and here, okay, I'm going to pull it on. This is interlock. Okay, so I'll pull on, okay, and same time again is 2 with the loop. In that case there will be a loop. Now here these loops again. Okay, by which you can see there are some suture materials here. You can see that is the continuous suture material, continuous suturing. Now it will be cut down, or like here. This is the muscular or continuous suture material, by which you will see this suture might like this kind of pattern. It will go like here, because there is a cutting here due to some suture material related, so there is a depression. On the other hand, it will look like here, like this manners. It will present like here. That is all about the open methods, and we did learn about the simple suturing, vertical mattress, horizontal mattress, continuous suturing, and subcuticular suturing. This is the basic suturing techniques that we use in the normal day-to-day practice. Okay, thank you very much for patience hearing. Thank you very much for watching. I hope you understand the videos, and I hope you will like my channels, and please subscribe and like my videos. If you have any complaints or if you have any query, please make down the comment below. Thank you very much. Now I'm going to start the continuous suturing. Continuous suturing is very important for muscular, not only muscular but also any wide open wound where the two edges of the wound is not opposed with each other and there is a very large gap inside. In that case, we have to make a tension suturing, so that the continuous suturing is the best. Okay, so continuous suturing. So I will make a continuous suturing where here. So I'll make this is since it is a linea alba incision or the midline abdominal incisions. So I'm going to make a muscular or the continuous suturing here. How? First, you can see the same direction. I'll make incision here. Okay, so first I will make stable suturing here first. This is surgeon's knot or the square knot. Square knot is done here, so it will be tighter. Next time again, okay. I will cut one end. Okay, this end will be regarded as a continuous material. How? Let me show you. Okay, here I am going to make a continuous. So again, it will be regarded as a continuous. Again, okay, you can see. So again, I make this incision again, same direction, or the same way. These things is not function because so much friable here. Okay, no problem. I'll make another. It's very disgusting. Again this done. You can have interlocking here, or if you don't want that, okay, like this way. If you want to do interlocking, that will be different things. Okay, I'll make an interlocking here. So when I give here the last portion, then it will be a last part. So here you can see so this is a knob a loop. So I'm going to pass it on, and here, okay, I'm going to pull it on. This is interlock. Okay, so I'll pull on, okay, and same time again is 2 with the loop. In that case there will be a loop. Now here these loops again. Okay, by which you can see there are some suture materials here. You can see that is the continuous suture material, continuous suturing. Now it will be cut down, or like here, this is the mask closure or continuous suture material, by which you will see this suture might like this kind of pattern. It will go like here, because there is a cutting here due to some suture material related, so there is a depression. On the other hand, it will look like here, like this manners, it will present like here. That is all about the open methods, and we did learn about the simple suturing, vertical mattress, horizontal mattress, continuous suturing, and subcuticular suturing. This is the basic suturing techniques that we use in the normal day-to-day practice. Okay, thank you very much for patience hearing. Thank you very much for watching. I hope you understand the videos, and I hope you will like my channels, and please subscribe and like my videos. If you have any complaints or if you have any query, please make down the comment below. Thank you very much.
ভিডিও হচ্ছে বলে
আসতে হবে।